to use or not to use. With recreational marijuana use becoming legal in Massachusetts next month, that's among questions some people who have used pot in the past are wondering about now. New England Public Radio reporter Karen Brown recently caught up with people considering giving pot another look, and in her reporting, she divulged her own past with pot. We began our discussion there.
Well, my assignment was, let's do a story about people who are going to start smoking pot who didn't smoke before. And the idea was...
With the advent of recreational marijuana coming toward us July 1st, right? Yeah.
Right. So it's part of our broader coverage about what does legalization mean. And since I'm a health reporter, my boss said, let's look at some of the health issues. And I thought, can we make this a little bit more fun? I do a lot of reporting where you go on the street and you just stop people and ask them about some current event. And I didn't feel like I can really do that with marijuana. I just felt that was a little bit too sensitive. So I went around asking my friends and my friends' friends, who has thought about smoking pot? Maybe you haven't for a long time. Maybe you're going to get back into it. I sort of just went off from those stories that people started to tell me and decided to even inject a little bit of my own history in there.
You definitely did. So you mentioned in the story that you once also smoked marijuana, and did you have to go to your boss and say, heads up here, folks, I'm going to talk about what is now illegal, it will soon be illegal, some of what I did in the past. Did you have a discussion with them about that at all?
Yeah, a little bit. I think, he actually said, well, you're not going to smoke pot while you're on the story. I was like, no, I don't take substances when I'm at work. And in fact, I haven't smoked pot for years and years. But
Which is what people in this story talked with you about. I mean, we're joking about it a little bit, but it's something that I think employers and employees will really have to consider. I spent some time, I lived in Colorado for a number of years, and it was something that there needed to be a new page in our employee handbook that said, much like alcohol, you can't come to work if you intend to smoke this now legal substance. You can't come to work high.
Well, kind of like alcohol.
Right.
It's the same idea. Yeah.
So you touched on medical as well. As you said, you're a health reporter. And you spoke with an epidemiologist who talked about some of the impacts that he has found, or what a recent study that he did. What were some of the findings in that study that you explored?
Well, I should preface that with the researchers don't find it that easy to study marijuana because it's still classified as an illegal drug by the federal government, so it's just not easy to get the substance to do a lot of studies.
And Lyle Kraker here at UMass has been sort of at the forefront of this issue, saying the FDA needs to open it up and make it more easy or more readily available for study. So, but they were able to study it, right?
But given that, they were still able to find about 100 studies and do sort of a meta study. And they found that it's really not very harmful. That was sort of their conclusion. Compared to alcohol specifically, for instance, you can drink yourself to death, in one go if you have too much, but it's very hard to do that with marijuana. It doesn't cause doesn't cause lung cancer or cardiac problems.
And I think that's one of the questions that's standing for people who might be considering, okay, do I want to try this if it becomes, when it becomes legal? If I smoke, am I at risk for lung cancer? Am I, as I am with tobacco? And the study looked at that, right?
Yeah, and it certainly seems tobacco is a lot more dangerous in that regard. Tobacco is not mind-altering in the same way, so, it could be dangerous to drive while you're smoking pot. And there are it can also, they found that there are certain mental illness symptoms, like with bipolar disorder, that can be worsened. And I believe maybe also depression. The symptoms can be worsened if you have a major depressive disorder.
But there's still a big question around edible marijuana, right? Because all edibles are not equal. There's a question about potency. Are they able even to understand that at this point?
The researcher did tell me that pot is a lot more stronger now than it was many years ago.
So the weed of today is not the same, which is something that people need to be aware of, right? Especially the folks in your story, you looked at two people in particular, a gentleman named Tom and a woman named Robin. And Tom told you that, he had smoked years ago, he now has children. Is he talking with his kids about this? Did you get into that at all?
Well, they're probably going to recognize his voice on the radio, even though I didn't use his last name. So he'll probably have to talk to them now.
Can't say you didn't do this, Dad. You told Karen Brown at NEPR you did.
Exactly. I think, I mean, there's still a difference between how healthy it is for adolescents and for kids. You know, there's evidence that it's not very good when
It really impacts the brain.
Yeah, and it's very different for adults. And my impression that he is going to have that conversation, and that's probably why he's going to wait a little while till his kids are older, because he doesn't want to model behavior that he doesn't want them to do, even if, you know, health-wise he feels fine about it for himself.
Is there still a stigma attached to this for people? You know, it's illegal still, even though we're approaching the fact that recreational marijuana will be legal. You know, is there a stigma? There was the whole campaign, Reefer Madness. There was a real, I think, concerted effort to keep people away from this substance. Are people still concerned?
I think people don't know yet. Just because it's all of a sudden one day to the next going to be legal, you've still got professional relationships. If you're a lawyer, you know, are people going to think, well, you know, I would like my lawyer to be very upstanding.
Right,
I don't know.
sharp.
Yeah. You know, and just because you might smoke pot or take edibles doesn't mean you're doing it on the job. But I think people don't yet know what that's going to look like, especially in professional circles.
Yeah, you mentioned in the story, you know, I haven't seen this much tie-dye, because in the story you went to a Grateful Dead concert.
Right, which is, you know, rules are a little bit different in a Grateful Dead show than
a little more open
in a lawyer's office. But yeah,
a little more open maybe. And there is that stigma, right? There's the stereotype of what someone who uses marijuana looks like, how they behave.
Right, and that stereotype is all at the Dead show. No, there's a stigma against probably not using marijuana at a Dead show, but definitely that is a very sort of 60s-esque hippie scene, and my guess is that as pot becomes more prevalent and it becomes legal, it's just going to be more of like an after dinner drink, you know, which is what my subject and friend Robin was sort of looking at it as.
And certainly in states where this has been legal for a while, like I said, in Colorado, there are now places where you can, you know, you've got yoga studios and other things like that are encouraging, or not encouraging, but just sort of infusing this into that culture. Here in Massachusetts, we know that the Cannabis Commission isn't, you know, making that readily available yet. They're just going to open up recreational shops, and then they'll take on the issue of whether or not there'll be some sort of public consumptive environment, like a bar for drinking,
right,
where you
like
would have
Amsterdam.
Yeah, exactly, something like that. We know as reporters there are things that end up on the cutting room floor that don't make it into stories. Were there elements of that in this piece for you, something that didn't quite make it into the story that maybe you wish had?
Well, I did talk to a number of people who have been smoking pot all along. They just didn't really care that it wasn't legal, and you know, it's not one of the their sense of it being a risky thing was not very high. So for them, it's not like they're deciding whether to consume pot or not, but it's more they're relieved that it's going to be above board. It'll be easier and safer to get. They feel they like the idea that it will be regulated and that they'll have a little bit better of a sense of what they're getting. So I thought that was interesting, that even though the legalization didn't make a huge difference for them in terms of use, it will make a difference in terms of comfort level and just convenience. Great.
Well, Karen Brown, the headline on the story is "To Light Up or Not, Gen Xers Reconsider Pot After Legalization," and people can listen to it on nepr.net. Thanks for coming in.